Since we're recording and I don't need to repeat myself, I'm going to now introduce a fabulous Canadian, Don Graham. He is a part of the administration team at Lyme OHO Canada, a national Lyme support network in Canada. I guess you guessed that because OHO Canada, Lyme Canada. As well, he's the founder of a national advocacy group called Canadian Lyme Coalition and is a member of Lyme Global. I would like to warmly welcome him to his presentation now on Canadian Tick-Borne Infection Survey. Thank you.
Thank you very much. It's a real honor to be here. I'm very happy to have this opportunity to participate in this group and have a little bit to contribute a little bit to the conversation. So far we've heard from Australia, UK, and Ireland. So now we're going to go look at another part of the world, which is Canada. And we're going to see that there's a lot of commonalities in what we have found and what we have to say, but maybe there's a few differences as well. So Lyme OHO Canada, we represent just over 8,000 people with chronic Lyme across Canada right now. And we've recently formed our own advocacy group, which is what Leona was talking about, which is Canadian Lyme Coalition. So I'm speaking here on behalf of both of these organizations. So we recently have just put together our own survey, which we're going to quickly go through the highlights from that. We're not going to go through detail. If you want to see the full survey, you're going to, of course, go along to our website online and take a look at that. I'm going to talk a bit about myself, first of all, because as well as being an advocate, I'm also here representative as a patient. I encountered my tick-borne infections back in 2014, which I think makes it about 11 years ago. I spent, I'm going to say, 8 years with disabling pain before my wife came to me and said, I need to revisit Lyme disease. I originally went into my primary care doctor thinking I had Lyme, and it was quickly shown that that was not the case. It's not even worth considering because chronic Lyme does not exist, certainly not in Canada. After 8 years, as well as disabling pain, I was pretty much ready for spending the rest of my life in a wheelchair. As well as that, and my personal life and my business life, I was operating 3 businesses with about staff of about 100. And I lost all 3 of those businesses through this process as well. So it's a financial hit, not just to me and my family, but to all those who were around me who were involved in my businesses. So we're going to cover 3 areas in this talk. First, we're going to talk about how they contracted their tick-borne infections, their interaction with the healthcare system, which I know can vary from country to country, and the impact of these infections on their own personal lives and the lives of those around them. So to produce our survey, we consulted very widely because, to be honest, I'm new at this. I obviously have a business background. I'm not in any way a health professional. So we consulted inside Canada with other groups, with doctors who did specialize in this area, a university. We consulted outside of Canada with other groups. Sharon, who spoke earlier, she was one of the people who helped me on this journey to put this together. We conducted the survey in the first 2 months of this year, and we had a total of 481 participants in the survey. So clearly our focus is on chronic Lyme, looking for those who have long-term symptoms. So here's the 3 parts we're going to go through quickly. So first, contracting your tick-borne infections. So we have a number of charts. So here in this first screen, those are those who responded, and we asked whether they had, prior to developing any symptoms, if they had indeed noticed a tick bite. And of course, we find that 47% of them did not in any way notice a tick bite. More generally, we also asked them if they had, in any time frame, actually detected an embedded tick and removed it, and 80% of them did not, whether we're looking at in the last 2 years or even longer time frames up to 10 years. The story is pretty much the same. Most people do not notice or remove an embedded tick. Then we looked at the geographic distribution of tick-borne infections in Canada. So Canada is organized by provinces. The first one, Ontario, it says 37.8. That's a little typo. That is actually the population percentage of the population in Canada that lives in Ontario. The actual number of people who percentage that reported the tick-borne infections is about 34%. 34 and 37 are very similar numbers. If you go through this, I didn't put it up there, but you'll see that the numbers here are very close match to the population mix across Canada. The only exception is Quebec. It's underrepresented. We did have the survey available in both English and French, but the engagement in Quebec was a little bit lower than the rest of the country. It's not that they have any fewer tick-borne infections, we believe. It's just the engagement was less. So what this is telling us is that ticks and the infections they carry are equally represented all across the country. It's not any region specific. We were even surprised to find that we were getting some positive results in northern Canada. That was a surprise to us. The numbers are very low there. The population is very low there. And the number of ticks bites are also very low, but it does mirror what's going on in the rest of the country. Okay, interactions with the healthcare system. So here, this is interactions with your primary caregiver, your primary doctor. So we asked them if your primary healthcare doctor recognized your EM rash as an indicator of Lyme disease. And 80% of people said no, their doctor did not associate any sort of rash as being emblematic of Lyme disease. We also asked them, what about your symptoms? Did your doctor recognize your symptoms if you did have symptoms that are associated with Lyme or other tick-borne infections? Did they recognize those symptoms as possibly being indicative of Lyme disease? And 90% of them said no, their doctor did not identify. In Canada, this is not surprising because doctors are not educated on the symptoms of chronic Lyme disease. Looked at testing. In Canada, we follow the US on most things, and this is no exception. So in Canada, we recognize the ELISA. As of February of this year, we recognize the two-step ELISA test, which is ELISA followed by another ELISA test. Some provinces are still doing the older ELISA and Western blot combination. But regardless, this is the only test that is recognized in Canada. The other tests, the Armin lab test that we have here, for example, is popular in Canada, but is not available through your regular healthcare practitioner. 24% of people have the ELISA test. The other tests are equally represented. The Armin labs, the immunoblot, Western blot are also very popular, but again, they're outside of the healthcare system. We asked them where you got your tests done. 55% said Canada, 45% other countries. But in fact, the reality is people can, in this survey, can choose to make multiple selections. And many people have a combination of both the Canadian test and tests from outside Canada. In fact, that's probably the most common testing format for those who have tick-borne infections in Canada. Again, I think it's not surprising to say that most of the ELISA tests had a negative response. 61% of the people reported that their tests were negative, and over 82% of the tests that were done internationally, they're mostly done either in the US or Germany, a few and other places, but the vast majority are coming from those two places. And these are most often the same people who are getting the negative result in Canada, and then a positive 80 to 83% they're getting outside of Canada. In Canada, we follow, or we attempt to follow, certainly with our group, OO Canada, the advice we give is to follow the guidelines as put out by ILADS in the US. And that's a combination of antibiotics and alternatives is the standard of care in North America, maybe different over here in Europe. And we asked the participants what guidelines their healthcare practitioner followed, and most of them, they didn't know. And the other column there is so large, 52%, is because most of them are providing their own guidance because this is outside of the Canadian healthcare system in Canada. They don't know where to turn for advice for this, and they're turning to the internet. They're turning to groups like ours, and this is the result. Some of the healthcare providers who do operate and provide help with Lyme have their own specific protocols, and some follow ILADs, and a very small number will follow the IDSA standard from the US. We asked them to choose from 3 alternatives in terms of their treatment strategy. I think I would have liked to have asked more detail here. I think there's more information to be gathered than simply what we've asked here that would be of value. So combination of antibiotics and alternatives, which is what I did, is obviously the most common, followed by antibiotics only, and then herbals and other supplements at 23%. Did they improve with treatment? So yes, 78% of the respondents said yes, they did improve with treatment. The scale on the right-hand side of their chart is a little confusing because what we ask people is on a scale of 1 to 10, how would you rate your level of improvement? So 5 would be right dead in the middle. And what we see here, the difference in these numbers is exaggerated here, I think. It's really saying it's about the same. Whether they chose a blended approach, the alternatives, or the straight antibiotics, they are reporting very similar results, which to be honest, I was surprised with. We didn't expect it to be quite like that. And if I didn't put up a chart here, if you looked at the mix of results, well, the average is 5.5, you'll see that it's all over the place in terms of how much of a benefit they said they get, how much their life has improved. Lots of people said they had small amount of improvement. Lots of people said they had a large amount of improvement. So it varies quite a bit, and it just happens to average out kind of in the middle around a 5 out of 10. 67% of people were diagnosed as co-infections. I think that number is fairly consistent with what we see in other countries as well. The mix of infections in Canada is similar to what you see in the US. We have the 3 Bs. We have Borrelia, Bartonella, and Babesia are the dominant tick-borne infections that we have in North America. I don't know, is it a bit different over in Europe, or is it pretty much the same thing? Borrelia burgdorferi is still the dominant strain of Borrelia here. It's the only strain that is tested for in the ELISA test. But we now have a mix of, depending which report you look at, about 14 different strains of Borrelia are now common across North America. On here, we've broken out, we got Borrelia at 27%, Bartonella at 24%, and Babesia, we got a couple columns for Babesia, Microti, and Oticola. You put them together, and we end up with about just over 20% there. So there's not a big difference in terms of the mix of Borrelia, Bartonella, and Babesia. They're all really important infections. In Canada, there is no testing for Bartonella. There is no testing for Babesia, whatever strain you're looking at. So you have no real hope of getting diagnosed easily with that within the healthcare system, because as far as they're concerned, none of those exist in a chronic form. The issue that was brought up about UK is also consistent here, that the majority of people are diagnosed with something else before they receive their diagnosis for Lyme. In my case, I was diagnosed with fibromyalgia. And the mix of diagnoses we get is quite broad. The biggest category is other, which means there's lots and lots of things that people are diagnosed with. Fibromyalgia, just saying it's in your head, it's depression, it's anxiety is very common. Arthritis is also also very common, and a little bit of the other things as well. The average time to diagnosis in Canada is 8 years, and maybe eight doctors before you get it. And it's because the system, you're on your own at that point. The same way, in my case, it was my wife that diagnosed it for me, because you're not going to get the diagnosis from the healthcare system, and it's only going to happen when you become desperate. We've gone through lots of financial resources. The strain on your family has been very hard. And at that point, you start looking for different things, and you come up with it, and then you find a way to get tested for it, to find a healthcare through networking. It's not through the healthcare system. The impact on people's lives. 80% of participants said they're unable to work for at least part of the time. 33% unable to work for over 5 years. The toll on the financial life of people is very difficult. That, in combination of the fact that you have to pay for your treatment yourself, you're not able to work. It's a terrible combination, which we see in other countries as well. This is the one thing that surprised me the most. Over 56% of people said they had suicidal thoughts. Combination of their terrible symptoms, the financial strain they're on, not seeing any hope. It's creates an almost intolerable situation. We look to see if this changed over the period of time. So the chart on the right looks at the number of years until diagnosis. If that changes, so yes, if you're looking at it, if you receive your diagnosis in less than 1 year, then you're less likely to have had time to develop those thoughts. Between 1 and 10 years, it's very high. Over 10 years, it drops a bit. Maybe you just develop skills to cope and to manage a little bit more over time, is all that maybe that is saying. But yeah, it's a terrible drain on the people and the families around them. From a financial point of view, only 36% of participants were able to truly manage the financial costs of whatever treatment strategy that they chose. Many rely on family and friends, but we all know that's only going to take you so far. It's only going to last so long. I would have liked to have a chance to ask more questions about and delve into this area further. But it is a big problem. Insurance is not such a big issue in Canada because we have a public healthcare system that's supposed to cover pretty much all of this, but there is auxiliary insurance available in Canada, and that insurance is not going to cover you for anything like that, like Lyme. I have one person who's on my team from Saskatchewan. He has suffers from neurological Lyme. And in his province of Saskatchewan, he's denied treatment for that, but he is permitted to get disability insurance, which seems like a contradiction. The state will not allow you to get cured, but it's willing to support you for the rest of your life if necessary with your illness, even though treatment options have been shown to be available. That's pretty much it for the presentation here. I think what would help us would be able to get this information in front of the healthcare authorities in Canada. That should be my job as the advocate. So far, we have not had any success with getting this information from them. They're not interested in paying attention to what we have to say. So the highlights here is that while it's clear the majority of patients don't receive a diagnosis early on from the family doctor, either based on symptoms or based on a rash, patients can improve with treatment. 3/4 of people have co-infections. 80% of them have impact on their ability to work, and over half experience suicidal thoughts because of their tick-borne infections. And that's about it for my.
Is the reluctance of the public health services to support treatment for chronic manifestations of Lyme disease due to ignorance of or recognition of that as a medical entity, or is it fear of the cost to the health systems, whether they're or a combination of both?
I think it's because in general, they don't believe it exists. There is a lot of research out there, and the research, to be honest, is contradictory. A lot of the research, you can find whatever you want in the research right now to either support or deny the position. They don't spend a lot of time listening directly to the patients. There was an initiative in Canada back in 2016, at which time I was lying on the sofa feeling sorry for myself, where they thought they had made the advocacy groups, the healthcare providers got together and were working with the healthcare organization. They thought they had made great gains. Legislation was passed that said they were going to spend time and look into basically chronic Lyme. And everyone was kind of celebrating because I thought a great step had been made. But in the end, nothing changed. Not a single thing changed with it. They didn't do what they said they were going to do. And the life of someone with Lyme did not change one bit. And I'm going to say the Lyme tick-borne community in Canada after that has gone through a period of depression. The leadership kind of gave up. And a lot of the organizations kind of fell apart a bit for a bunch of years because they failed and they didn't know how to go forward from that. So now I and a few other people are coming forward and saying, no, we can't give up on this. We have to keep moving this forward. So we're going again, but we're basically starting from scratch all over again and developing relationships with the healthcare authorities at the federal and provincial levels, and to begin anew. And I think in this time, I think we would benefit by coordinating with other countries. You can see that stories are very similar. We don't ask exactly the same questions, but really the lived experience is similar. We're at different stages. In Canada, ticks and Lyme are recognized. There's no question about that. They deny the existence of the longer-term chronic infections and the co-infections, where Sharon is fighting the battle that just to get the fact that they're even existing in their country. So countries are at different states, and our healthcare systems function a little bit differently, but we're all fighting kind of the same battle. Surely we would benefit from sharing information. A win for Sharon would be a win for me, and vice versa. So we think that there's a need for more coordination going forward this time around, that we can all share in success this time.
Thank you so much for the presentation. We are fellow Canadians, so this is very relevant for us. We are practitioners. We're not practitioners, but we're kind of doing similar research as well in terms of the surveillance and how that gap in clinician education, especially acute management, because we practice in BC where it's thought to be the lower risk than other areas. So I'm wondering if there's any way with the information you've already gathered, if you could do analysis on where people were sort of missed as it relates to chronic Lyme, whether it be or was it other places.
So are you asking me where there's more cases of chronic Lyme? Is that what you're asking?
Collected that we can kind of differentiate where they were missed. Was it BC versus Ontario, where Ontario has traditionally been a higher risk area versus BC where they say it doesn't exist? So it would be interesting just to see what the differences are, and so especially the acute misdiagnosis and the rapid knowledge there.
Sure. Well, what we found is it's everywhere in Canada. It's pretty evenly spread all around Canada. I know the issues in BC are a little bit different in Ontario. You can go to my website, CanadianLymeCoalition.ca, and you can see all the questions and all the answers. If you want to see the data, analyze it a little bit differently, you want to see something else that's not clear to you, talk to me. If I have the data, I'd be happy to share it with you.
Thank you for your presentation. I'm coming from Germany, and what's been noticed, which was very interesting for me, to get the difference concerning the different kinds of treatment for patients. The results were very similar.
And how do you explain that?
I'm not sure I can, because to be honest, it surprised me. I expected to see more differentiation in the treatment. A lot of the doctors follow the multiple antibiotics protocol that's promoted by ILADS. That's the most common. And I expected to see that as the most effective, and it didn't come out that way in our survey. I would like to have a chance to go back and ask people some more detail to find out if that's truly representative, because if it is, that's important information for us to know. But at the moment, herbal treatments can be effective and powerful. We know that. But that's what the results, that's what the results of this particular survey showed.
No, we have some time. Thank you for that. That was really interesting, and I'm really, really excited about the data. You said that 78% of the people improved.
Right.
And that was, I'm just kind of correlating with themes here. Do you know how long these people have been sick and then they got treatment and then 78% improved? Do we know, do we have a mean or an average length of how long they've been sick?
No,
No.
I should have that.
No,
But
yeah, you included these people because they asked the questions that I've been sick one time.
right. I did not ask, and I should have, exactly how long have you been ill, right?
Yeah.
Yeah. Mhm.
The statistics of 78% is actually seen in UK and Ireland. There's also seen in LDA, but it really depends on the type of treatment and protocol. So,
Well, you may see that as a difference in the different treatment option, won't you? That how they got better, but how much better may vary depending on the treatment options, and also how quickly they got better could vary by treatment options. I would love to know that information as well. Right?
great.
Thank you very much.